Assalamualaikum everyone. Today I'm going to talk about encephalitis. So every one of us know that the brain is covered with a layer which is called the meninges, and whenever there is inflammation in the meninges, we will call it meningitis. But whenever there is inflammation in the parenchyma of the brain, we will call it encephalitis. So what are the signs and symptoms of encephalitis? The sign and symptom of encephalitis depend upon the area of the brain involved. So it is an inflammation, so the patient may experience the fever, headache, neck stiffness, and there may be swelling of the brain area which is involved in inflammation, and there may be altered mental status, and the patient may be in confusion state. So what are the causes of the encephalitis? The causes of the encephalitis are divided into viral, bacterial, autoimmune, acidic or protozoal, and medication related. So the most common cause of encephalitis are the viruses, and the most common viruses are the herpes simplex virus type 1 and herpes simplex virus type 2. Encephalitis can also caused by the measles virus and polio virus and varicella zoster virus. So the bacterial encephalitis are those which is caused by the bacteria, and the bacteria which cause the meningeal inflammation can also cause the brain parenchymal inflammation. So the bacterial meningitis can result into encephalitis. Now the autoimmune are those in which the immune system are activate against the brain parenchyma. So the one type is the anti-NMDA receptor encephalitis. The protozoal or parasitic are those which caused by the protozoan or the parasites, and the common type are the toxoplasmosis encephalitis and the malarial encephalitis. So now, how to diagnose the case of encephalitis? We are going to diagnose a case. We should always start from the history taking. From the history, then do the examination, and then go for the investigation. On history, we should ask about the patient previous infection exposure, and about the headache, and an examination may have neck stiffness, and the patient may be in confusion state, and the patient mental status may be altered. And so investigation, we should go for blood test in which the CBC count can be raised, and we should go for EEG in which the brain electrical activity can be altered, and we should go for the cerebrospinal fluid analysis in which we can find the abnormal cell count, in which we also do PCR to detect any antibody present in the CSF. So by this way, the encephalitis can be diagnosed. Now, how to treat the encephalitis? The encephalitis treatment depends upon the underlying cause of encephalitis. If it is viral encephalitis, we should do the antiviral drug to the patient. If it is bacterial encephalitis, we can give it antibiotic, but the corticosteroid killer for the headache can be given to the patient. And whenever the encephalitis is associated with the seizure, we can give the patient anticonvulsant. So this was all about an encephalitis. For more videos, subscribe, like, and share. So thanks for watching the video.